Having nurses within Harris Health is very important. One of the nurses actually came to me and said they had a slogan for nurses overall, and it's, we take care of the underserved, but we don't underserve in our care, which is very important. That means we give the best to those that we care for.
Aunt Minerva. She really inspired me to become a nurse when she was diagnosed with breast cancer. I really wanted to help her more. I really wanted to be there more. So going to her visits with her, I was able to experience what the nurses were doing and what the doctors were doing. And I wanted to do that. I really wanted to make that impact and show that care just for more people within the community.
I feel like a great nurse should have empathy.
Empathy.
Empathy. I think empathy is so important in the everyday work of a nurse, wherever they may be practicing nursing. Being able to really step into someone else's shoes, really understand where they're coming from.
Especially in correctional health, those patients, they have a lot of comorbidities. They face a lot of different, problems. It's definitely very stigmatized. I don't think it occurs to a lot of people just walking down the street in the States like, oh, yeah, people who are incarcerated need health care too.
Even though they might not have the same needs as others, doesn't mean they don't deserve the same health care we other people get. So I feel like being here and be able to give back is why we need to have nurses here to support that.
Well, I had a nurse leader recently say to me, Dr. Padilla, every time I have to make a decision now around one of the things that I'm working on, I hear your voice in my head, and I hear those words you said to us a long time ago about remember the impact on the patient. If you can always take the work and decisions you make back to how will this help my patients, then you'll do the right thing. And that meant a lot to me. It means a lot to me to know that even in the work I do today, I can help make a difference for patients just in a different way, but I'm also making a difference for nursing leaders that are developing here.
The foundation of our nursing practice is here within these walls. Every facet of nursing practice starts here, from our nurse residency program on up to our Enrich program, from when our clinicians move into management. At every point of a nurse's career, we nurture that. It's really important that our nurses understand that, yes, we want you to be clinically sound, but we also want you to understand the science behind what you are doing, and that the things that we are teaching you and the policies and procedures that we are developing, they are rooted in years of research. They are rooted in what is best practice, and this is what's going to make you a safe clinician.
Working in the Harris Health specifically, I'm seeing the work that we do that many people don't want to do. We embrace it. It has made me a better person and a better leader, because I see how much value we bring to the community and how much great good that we do.
The best thing about being a nurse is seeing the smile on patients' faces after you take care of them, or seeing the gratitude on another nurse's face after you've helped them work through something, or after they've completed a skill that you helped teach them.
Thank you. Thank you for showing up every day, bringing a part of yourself. Even when you aren't feeling great, you still come in and take care of those who are feeling worse than you are, who have less than you do. You continue to give of yourself, your skill, your compassion, your commitment. It is humbling to watch the work that you do, that you are willing to continue to do for our patients and their families.
Happy Nurses Week.
Happy Nurses Week, everyone.
Happy Nurses Week.
Happy Nurses Week.
Happy Nurses Week.
Happy Nurses Week.